You know, we all think of checklists as a good thing, right? They're designed to make sure we don't miss anything important. But what if I told you that in medicine, that very same simple checklist could actually cause a total disaster? We rely on protocols to standardize care, but what happens when following that list makes us blind to the bigger picture? Today, we're diving into the checklist trap and how putting too much faith in rigid rules can change lives forever.
Okay, to really get what we're talking about, let's look at a real-life case that just tragically illustrates the stakes here. This isn't some abstract theoretical problem. It has a real and very human cost.
So this all starts with something you've probably heard a million times. A 12-year-old girl, and her only complaint was she was just always tired. You know, a symptom that can mean almost anything or, honestly, nothing at all.
So they did the standard thing. They ran a blood test, and it came back showing low hemoglobin. And bingo! The protocol, the checklist, it pointed to something super simple: anemia. So the next step seemed obvious: prescribe some iron tablets.
And this is where things start to go so wrong. 2 full years go by. The girl keeps taking the treatment, but she's not getting any better. And despite that, they just kept her on the same protocol. No one stepped outside that checklist to ask, why isn't this working, or to do a simple physical exam.
Finally, when she's 14, she gets this sudden, sharp stomach pain, and a doctor finally does a hands-on examination. And what they found? It was just shocking. Her tiredness wasn't from anemia at all. It was a massive tumor on her kidney. The clinical eye saw what the checklist had made everyone completely blind to. And the price for that 2-year delay? It was huge, and it's something she'll have to live with for the rest of her life. She lost a kidney, and now she has chronic high blood pressure. The source material for this story calls this a preventable and even negligent complication.
And you can just imagine her father, left asking this one heartbreaking question. It really gets right to the core of the problem, doesn't it? Why did something so basic, a hands-on exam, take 2 years? And the worst part is, he never got an answer.
And what's so frightening is that her story, it's not a one-off. It's not some freak accident. This is a pattern of harm that we're seeing.
Take another case. A patient comes in, and it looks like a simple teething problem. The protocol says, prescribe teething gel. Easy, right? But the nurse completely missed the importance of the patient's own words, blood trickling. The checklist didn't prompt for more questions, and a fatal blood clotting disorder was totally missed.
Or how about this one? A patient with a rash. The algorithm spits out a diagnosis: shingles. But it wasn't shingles. It was a staph infection. And because they were treating the wrong thing, it blew up into life-threatening septic shock. You see how that checklist can give you a false sense of security?
And this next one, it's really disturbing. A child is brought in for urinary problems. The clinic used a symptom-only protocol, which means no physical exam was required. And because of that, the clear physical signs of sexual abuse were completely, utterly missed. A system designed for efficiency failed to protect a child.
So you see what's happening here, right? These aren't just a few isolated mistakes. They're all symptoms of a much bigger systemic issue, a problem we're calling the checklist trap.
Now, there's a technical name for this: diagnostic error. It basically means a diagnosis is wrong, or missed, or just comes way too late. And a really key word in that definition is omission, like failing to do a physical exam.
And the numbers here are just mind-blowing. This isn't a small problem. In the United States alone, we're talking about more than 1 million people harmed by these errors every single year. And for up to 80,000 of them, it's fatal.
This really gets to the heart of the conflict, doesn't it? On one side, you've got the algorithm. It's rigid, just a list of pre-printed questions. It can't really handle anything unique or weird. But on the other side, you have human judgment, what one source calls that precious moment of human choice. That's where experience and intuition and the ability to spot serious patterns come into play. Patterns that just don't fit into a neat little box.
And this image, well, it just says it all. The root cause. We are replacing the powerful, nuanced clinical eye with the mechanical simplicity of a protocol, a symptom checker. And we've just seen exactly how devastating that trade-off can be.
Okay, I know this all sounds pretty grim, but it's not hopeless. There is a way forward. So let's talk about the solution, about how we can build a safer approach for everyone.
Look, the answer isn't to just toss out all the technology. It's about shifting our reliance away from these rigid, tick-box protocols It's about getting back to patient-centered care, where we actually empower doctors and nurses to use their training, their experience, and their nuanced medical judgment.
I love this quote. Your eyes don't see what your mind can't think. It's so true, isn't it? A checklist can only see what it's been told to look for, but a trained clinician's mind, that is a whole different ballgame. It's filled with years of knowledge, allowing their eyes to see connections and possibilities an algorithm could never even dream of.
So I want to leave you with this thought, as a question for all of us, as patients. Of course, protocols and algorithms have their place, but we have to understand their limits, because when it's your health on the line, when it's something as messy and unpredictable as the human body, is a checklist really ever enough?